Hi everyone, you're watching the Southern Institute of Technology's Certificate in Health Science. Today we're concentrating on the cardiovascular and the respiratory systems. I'm here with Nicola and we're going to get the ball rolling with the cardiovascular system. Alright Nicola, exciting business. Can you tell us what parts make up the cardiovascular system?
Well, actually I work for the Heart Foundation, so obviously the part I think of most is the heart. But the cardiovascular system encompasses much more than that. The whole vascular system, which is the heart, which is a muscle pump, pumping blood right round, oxygenated blood right round your body. And then you've got your arteries and your veins, and it's supplying all the organs of your body, including your brain.
Right. So how big would the heart be?
Oh, it's about the size of your fist and sits in the centre of your chest, and it's a very strong muscle pump. And obviously it can't have a rest, otherwise you're dead. So really important that we look after our heart.
How important is our cardiovascular system then in our human body?
Well, it's very important. It's the most important system of our body. And it's really important that we keep it healthy. We know that 40% of deaths in New Zealand are attributed to cardiovascular disease. So it is the biggest cause of mortality in New Zealand.
Gee, 40%, that's huge. So what are some of the cardiovascular diseases and problems that can occur?
Well, probably the main thing is when we're born with beautiful clear arteries like this, and we all hope our arteries are nice and clear and clean pipes like this. But what can happen as we age, and depending on our lifestyle, is a fatty plaque can build up in your artery, depending on your diet and whether you smoke and whether you take enough physical activity. And this fatty plaque can cause inflammation, which could then cause a blood clot. And if that was an artery leading to your brain or to your heart, that would cause disease of that tissue that was going to be supplied by oxygenated blood, can't get through.
Gee, that looks terrible. So how long would it take to sort of get a build-up like this in the artery?
Well, that's variable, and a lot of people will be walking around with arteries in bad shape without realising it. They'll probably think, you know, I'm a bit tired, or when I do a bit more exercise, I'm a bit breathless, so perhaps I'm not fit. But in actual fact, they may have this fatty build-up or a plaque, or it used to be called hardening of the arteries. The correct term is arteriosclerosis, and they may have quite bad arteriosclerosis without realising it. So it's really important that they go to the GP and get a risk assessment done to work out whether they are at risk of having heart disease, heart attack, stroke.
Right. So the arteries, are they sort of leading all around our body? Is that how arteries work?
Yeah, arteries are going throughout your body. They're circulating blood right throughout your body. So the arteries carry oxygenated blood around your body, and the veins carry blood that's lower in oxygen back to the heart and lungs to be re-oxygenated and pumped around again, and that's obviously an ongoing process.
Right. So how does oxygen get into the blood?
Through the lungs. So the heart will pump blood first to the lungs to be oxygenated, then it feeds itself and then around the rest of the body. So it's got a long way to go, you know, it's got to get right down to your feet and back up again.
So you're saying about perhaps, you know, going to the doctor or someone to check about all these different things. How could they tell that we have, say, blocked arteries or something looking like this? Okay,
well, we can actually check to see if what people's arteries are like by doing an angiogram, but the first thing, all men over 45, all women over 55 should be getting a heart health check, which would include blood test, height, weight, blood pressure, cholesterol tests, blood glucose, and then they look at it like a big picture. Instead of just saying this person's got high cholesterol or they smoke, or they look at the whole picture and whether the person's likely to be at high risk of heart disease. So they actually have risk assessment tables that they can look at and say what your risk is going to be likely to be within the next 5 years of having a cardiac event.
So we all sort of know what the risk factors are, but can we go over them again? Sort of the risk factors involved, you know, for unhealthy lifestyle and heart disease.
So what we're looking at first is nutrition. People eating a wide range of foods, predominantly foods like fruit and vegetables, bread, cereals, small, you know, a moderate amount of meats, protein, dairy products, and really reducing the amount of sugary, high energy dense food that we're eating, high fat, high salt, high sugar food.
So nutrition's a big part. What else?
Physical activity. So we're advocating that people do the push-play message, 30 minutes of physical activity on all or most days of the week. So that can be physical activity and sort of snacktivity, bite-sized portions of physical activity. Snacker-size, yeah. Where, you park the car a bit further away. You know how we always try and get the closest park to where we're going, park a bit further away and walk, mowing the lawns, doing your housework, cleaning the car. All of those add up to your 30 minutes of physical activity.
What exactly is angina?
Angina, okay, so if we're thinking about angina, this is where you've got this fatty build-up in your artery, and when you have increased need of oxygen to the heart, so you've had a big meal or it's particularly cold or you've done some exercise, there's not enough blood getting through, and so people get short of breath and they get pain. So that's called angina, but it actually hasn't at that point damaged the heart muscle because it hasn't blocked off the oxygen completely. So those people will often carry a spray that they take to relieve the angina and to open up the artery some more.
Great.
But yes, it could go on to being a heart attack.
And if people are wanting more information, Nicola, do you have a website?
We do, yes. There's plenty of information at www.heartfoundation.org.nz.
Great. Thanks for your time. Craig, we've just been looking at the cardiovascular system, and of course blood plays a really important role in that system. How important is blood in the body?
Blood is vital to life. If you don't have blood, you die.
Sounds drastic.
Well, it can be.
So how does blood actually move around our body?
Blood's pumped around your body by your heart, and the heart beats at a resting state somewhere at about 70 beats a minute. So you can figure out that it's a fair number of times that it beats a day.
So is it sort of in cells or tubes, or how does it move around?
Well, the cardiovascular system is essentially a series of like tubes. You have the blood comes out of the heart and goes into the arteries. It then goes down to the capillaries where it diffuses out and the oxygen and nutrient transfer takes place at the cellular level, and then it goes back into the venous system where it comes back to the heart.
Gee, that's quite a process. How much blood do we have in our bodies?
Depends whether you're male or female. The average is between about 4.5 to 5 litres of blood.
Is that's roughly for both?
Yeah, well, small females, adult female is about 3.5 litres, and a gigantic male would be about 5.5 litres. So it's in that region.
And how many different types of blood are there?
There are 4 major blood groups. You can be either A, B, AB or O, and those are further subdivided down into Rh positive and Rh negative.
Right.
So essentially there's 8 sort of blood groups that people think of.
Okay. And are some a lot more rare than others?
Yes. O is the most common group, and O positive is the most common, going down to group AB negative, which is the least common blood group.
Right. And you said blood's, so vital for life, but why is it?
Because blood does a number of functions. It carries oxygen around the body, and you need oxygen. The cells need oxygen to function. It carries nutrients around the body to all the cells. It contains the clotting factors to stop you bleeding if you cut yourself, and it also contains all the white cells that look after you when you get infections.
So where is blood made?
Blood's made in adults anyway, in the long bones, so that's in the legs, your arms and your sternum mainly.
And how is it made?
There is a stem cell, which is the cell that you often hear about in the news that they use for research. It's the cell that decides, it can divide into all manner of forms, and it makes your red cells, your white cells and your platelets. And what it's making at a time depends on what's going on in your body. So if you are rather anemic, your body wants to carry more oxygen, it decides to make more red cells. Or if you go, the mountaineers that go up the top of mountains, they need more oxygen, so their body makes more red cells and it becomes thicker, so they make even more to be able to carry oxygen.
Gee, it's fascinating, the body, isn't it?
It is.
I don't know if you know this, but why is blood red?
Blood is red because in humans anyway, the hemoglobin molecule is based around iron, and iron is red, so human blood is red. For argument's sake, if you were a crocodile, they make their blood round copper, so their blood has a bluey greenish tinge.
Really? Is that for real?
That's for real.
Gee, interesting. That's my random tip for the day. I suppose being in the blood bank, I'm going to have to give blood.
Well, we could sort of show all your viewers what happens and
Yeah.
how painless it can be.
Painless, do you promise?
I try.
Which arm?
Whichever one you like to give me.
Great, I'll roll up this one.
Right, if you just like to rest your arm here.
Oh, I haven't done this for a while.
Oh. We just put this around your arm to sort of make the veins a bit easier to find. If you just close your hand for me.
I feel a wee bit nervous.
So do I.
Do you have difficulty sometimes getting veins up?
We do, and particularly patients who have to have a lot of blood tests.
So you can test the blood for all sorts of things?
Yes, yes. In fact, the advances that are made in the field of blood testing keeps an awful lot of patients out of hospital.
I don't know if I should have looked at that or not. That wasn't too bad. Do I keep my fist?
You can relax your hand.
Do you have a problem with children?
Not often.
Right. Is it mainly the adults?
Yeah. Generally speaking, in the hospital, the children are generally bled in the children's ward, and we really only get a few outpatients. And doctors do try and limit the number of blood tests they need on children.
Right. Say now you've taken blood, you know, obviously we can test bloods, but other times it's donations of giving blood. What happens to the blood once it goes from the person's arm?
The blood service is now centralised more in New Zealand. Most of the blood that's collected locally here is sent to Christchurch, where all the units are tested, and they test them for hepatitis B, hepatitis C, HIV, syphilis, and on occasions they test them for other diseases if they're going to people who might need special things. And the blood is then has lots of labels attached to it, telling us what blood group it is, where it's come from, what the product is, because a pint of blood that you donate can be turned into quite a large number of different products.
Right.
It's not necessarily just kept as a bag of blood.
Like what sort of products?
They can turn it into or some of the things is they make cryoprecipitate, which is when you spin a unit of blood down, you get the liquid on the top of it, and that is frozen rapidly, and it contains all the clotting factors, and that's transfused or can be transfused to the likes of haemophiliacs, or it can be given to people who have massive transfusions during operations. It's also can be turned into products like albumin for people who have been in severe burns, and on occasions people who Rh negative mothers who have Rh positive babies have an injection of anti-D after they've delivered their baby, which is to stop them making antibodies in future pregnancies, and that all comes out of donors as well.
Thank you, I've never known so much about blood.
It's quite all right.
Thanks for your time, Craig. Craig's now going to fill us in on the respiratory system. This is a really great model we've got there. Yep. I take it this is the respiratory system?
This is indeed the respiratory system. And as we can see, it's made up of a number of very important components, and we'll just merrily make our way through each one. So the first thing we've got up in here, which we had talked about when we did the sense of smell, you've got your nasal passage. Very important, because up here in your nasal passage, air is humidified and made moist and warm. Your body likes warm, moist air. It can get the oxygen out of it easier. So it's like a giant mixing chamber up in there. And the hairs in your nose filter out dirt and all sorts of little wee bits and pieces.
So if the air comes in really cold, it can sort of warm it up?
It does. It warms it up. And that's why you find breathing really cold air harder than breathing warmer air. So from there, it makes its way to this part here called the pharynx. And they all tend to have interesting names, the respiratory system. And the pharynx is the bit right at the very back of your throat. So if you ever get a sore throat and you feel it right at the very back and it hurts a wee bit to swallow, that's your pharynx. And that area there is fairly close to a little wee flap of skin that decides if air is going to your lungs and food is going down into your stomach, not the other way around. You don't want food going into your lungs. So then we come down to this bit, which most people know about, which is your larynx or your voice box, right in the very front here, behind all this tough cartilage. Because now we're getting into nice soft areas in here. We've got bones to protect the respiratory system up here, and we've got bones to protect it down here. So we need something to protect your airway in here. So we've got these big thick rings of cartilage. Then we make our way down to this bit, which is your trachea or your windpipe, as people learn it. And that comes from about here all the way down to about the middle of your chest.
Yeah, I was just thinking, it looks quite long, doesn't it?
It's reasonably long.
And so the main purpose of that is just to get air going
That's
down.
going to carry air. That's basically pretty much what it's for. And then we separate into our two lungs, and our heart actually sits in here.
Okay.
And it goes slightly over to the left. So your left lung is smaller than your right lung to make room for the heart. So we make our way down and we get into these fairly small little wee tubes here called bronchi. And if you think, bronchitis, an infection in there, and on these even smaller ones called bronchioles, that's where we get the term bronchitis from.
Right.
But we still can't take up the air yet. We still can't get it into our bloodstream because it's still not small enough and it's still not thin enough.
Right.
And on the end of all of our little bronchioles, we have these things called alveoli, which means little bunch of grapes. And these are at the very end of the bronchi. And if we could open out all your alveoli, it would occupy the area of a tennis court.
Gee, how small are they?
Oh, incredibly small. They're only about 1 cell thick.
Wow.
And this is where we make our link to the cardiovascular system, because running all over the surface of the alveoli, you have got little capillaries, and what they do is oxygen will diffuse out of your alveoli into your blood, because the gap's so narrow, away it goes to the heart, around to your body. And at the same time, other blood vessels are bringing in deoxygenated blood for carbon dioxide to move out of your blood into your lungs, and you breathe it out. Very simple, very effective little system.
Gee. So tell me once more, what's the purpose of the alveoli?
That's the place where oxygen gets out of your lungs into the blood, and carbon dioxide gets out of your blood into your lungs. So it's an exchange point.
So it's quite linked then to the cardiovascular system, the respiratory system?
Oh, yes, it is. And this is what athletes, for example, want to make sure that they've got a good respiratory system, nice large lungs, the ability to take up lots of oxygen. Because if you're an athlete, if you can take up lots of oxygen and get lots of oxygen into your bloodstream, then you can deliver it to muscle and you can work more efficiently.
Yes. So it's a really important, it's one of probably the most important systems of the body?
Absolutely, very important. You can only survive 4 minutes without oxygen.
Gee.
You can go for days without food, hours and hours without water, but you can only go 4 minutes without oxygen. And so seriously does your body take it. That's why we protect the upper part with your skull and your bones of the face. And of course, all this area here is protected by your rib cage.
What effects does smoking have on the respiratory system?
Well, serious effect on the respiratory system, I'm afraid. Smoking is never good, but some of the things that tend to happen with smoking is When people inhale cigarette smoke, it's actually at a very, very high temperature. And people don't tend to feel it because all the linings of the respiratory system are nice and moist. But all the way down here and coming down into the lungs, we have lots of very, very fine hairs. And their job is to catch things like insects you inhale and bits. And it beats all this way and it brings them all the way up, and then you feel the need to cough, blow your nose and get rid of it. Well, the cigarette smoke burns all the little wee fine hairs all the way down. So the self-cleaning mechanism is gone. And then we have other things like you've got tar, for example, and cigarettes finds its way here. And because there's no hairs to pick it up and beat it back out again, it dribbles its way with gravity down into these tiny, tiny, tiny little areas down here, into the bronchi, down into the alveoli, and affects them. They lose their elasticity, they lose their ability to help oxygen move into the bloodstream and help carbon dioxide come back the other way. So it's a pretty nasty thing to have to be doing to yourself, to be honest. But people who smoke, for example, and give up, the system can clean itself out and repair itself. But you can't be smoking for that to happen.
So how long would it take to repair? Quite a long time.
Well, it depends how long you've been smoking. Some people would say that with regular smokers, some systems are back to being okay after about a year and a half or so of smoking.
Really interesting. Thank you very much for your time, Craig.
Not a problem.
Of course, the purpose of the respiratory system is so we can breathe. So, Gussie, it's a big question, but how do we breathe?
Right. Well, intercostal diaphragmatic breathing, or whole chest breathing, is a technique we all need to master. And in particular, it is of benefit to people who do have respiratory problems. The rib cage consists of 12 pairs of ribs, and between those ribs, the intercostal muscles are situated. The lungs, these two rather large pear-shaped organs, are in the rib cage, but very importantly, in the floor of the chest is a huge muscle called the diaphragm. This shows the rib cage with the ribs cut away to show just how large that muscle is. When we breathe in, the intercostal muscles lift the rib cage up and out, and the diaphragm flattens and goes down and out, and so we get more room for the lungs to expand. Some people, of course, never use all their lung capacity. They only use the top part of the lungs. But with intercostal diaphragmatic breathing, the entire lung area is emptied of the stale air, and the fresh air comes in right from the bottom to the top. And with intercostal breathing, we fill the lungs from the bottom to the top. If you've noticed the singers, the three tenors singing, you will notice that they never ever move their shoulders. Their shoulders are always straight. They use all of this area here.
Right.
So I would like to demonstrate now. I'll get Phil to come in, and I will show you just what happens when we use intercostal diaphragmatic breathing. Right. Now, if we have a look here, these shoulders must always remain down and relaxed. Relaxation is one of the key things.
Right.
The most expansion occurs over the 6th and 7th rib, and the biggest space in the human body is when we do intercostal breathing, and we've got more space for the lungs to expand. So I would like to ask Phil to breathe in through the nose. I do that for a reason. If he breathes in through the mouth, all the dust in the air will go into his lungs. But there are lots of hairs in the nose, and they catch all the dust fragments or anything else that's in the air. So Phil, I would like you to breathe now, concentrating on getting the air into this part of the body. Would you do that, please? Now, you notice how his shoulders raised up.
Instantly.
As I said, the three tenors never raise their shoulders. The expansion is all done around this part. Now, would you breathe in, please, so I can feel those rib cage expanding? Excellent. Would you hiss out through the mouth? Very good indeed. Now, would you take another breath and do that again? Excellent. And hiss out. Now, did you notice that the stream of air was very steady?
Constant,
That means he was controlling that air from the stomach muscles down there.
So whereabouts is the diaphragm actually situated?
The diaphragm is situated in the lower part of the chest, and it goes up like that. I'm sure when you've been young, you've always been winded. You have experienced somebody punching you there and knocking all the wind out of the diaphragm. When he breathes in, that went down and out. The rib cage goes up and out.
Right.
And it's very important also that he keeps these shoulders relaxed. All of his body should be relaxed. We should be in a position of tonicity. That's just as an athlete is when he's on the blocks. But people don't relax properly either. So I'm going to demonstrate with Phil, if you'd mind lying on your back on the floor.
Great.
Thank you. Right. Now, everybody should be able to do this too. I'd like you, Phil, to raise your knees until your feet are flat on the floor. Spread your knees until they're the width of your hips and your feet. Okay? And would you get that wee pillow for me, please,
Sure
Melissa?
thing.
And we're going to put this under his head. Now, this is another technique. Put the head down and press your body flat into the floor there. Now, in this position, we have aligned his spine. A lot of people stand, if I can get my hand under his back, no, I don't want to do that.
So he's got to
that
press
means
it
he's
right.
got to sway back.
Right.
People with a sway back should practice this. That's a very good technique. And very often when you're going out somewhere and you're in a hurry, you think, oh, I haven't got time to do all this stuff. It's the very time when you should spend 10 minutes spread out like this.
And push your back into the floor.
Push your back into the floor and also just breathe quietly with no tension in the shoulders whatsoever.
Right.
Wonderful technique. And of course, it's always when you're busy that you should do this, and that's when you've got the least time.
Yes.
But everyone should try and practice this relaxation technique, align their spine. Remember, Melissa, you're only as young as your spine.
Right.
Once
I'll
that's
remember
gone,
that.
people have all sorts of trouble. So if you can think of how your spine is aligned there, can you feel that? Now, could you get up and stand up like that, Phil, and keep that spine at the same level that it was?
So you wouldn't actually need to stay down there very long at all,
Oh,
would you? Just
well, if you were in a state of great tension, I'd stay there for 10 minutes.
right. Okay.
And just think of nothing, or be in a warm room with some music playing, soft music, not some really beaty stuff to get you all hit up, but some nice soft music, and you'd be surprised how much benefit you would get from just doing that simple exercise.
As you've been going along, I've been actually practicing holding myself in.
Well, you shouldn't hold yourself in. All the belly muscles, when you're very in a state of tension, relax that belly.
Right.
It has to be relaxed, otherwise you just get all hit up. And it has a great, if you're a speaker, it sort of works its way up into your jaw and stiffens everything up.
Of course. Thank you very much, Gussie. I've learned a lot. Are you feeling relaxed, Phil?
Very relaxed.
Thank you very much, Phil.
Great. Hope you've enjoyed watching our show. You've been watching the Certificate in Health Sciences. You'll have to join us again next week when we'll be looking at the digestive and the urinary systems. If you'd like more information about this program or any offered by Sit to Learn, you can contact the team on 0800 Sit to Learn. Bye for now.